The disorders covered in this unit are the bipolar and related disorders and the sexual dysfunctions. Unlike ICD-10 and DSM-4, DSM-5 puts the bipolar disorders in a separate chapter from the depressive disorders. Bipolar and related disorders are separated from the depressive disorders in DSM-5 and placed between the chapters on schizophrenia spectrum and other psychotic disorders and depressive disorders in recognition of their place as a bridge between the two diagnostic classes in terms of symptomatology, family history, and genetics. There are 3 disorders in the bipolar chapter, along with 10 specifiers that can be applied to each diagnosis. Be sure to review the criterion-based definition of manic episode, hypomanic episode, and major depressive episode, which are on pages 124 and 125. In order to meet the criteria for bipolar 1, there has to be a history of at least 1 full manic episode. In bipolar 2, there is a history of at least 1 hypomanic episode. Sexual dysfunctions are a heterogeneous group of disorders that are typically characterized by a clinically significant disturbance in a person's ability to respond sexually or to experience sexual pleasure. An individual may have several sexual dysfunctions at the same time. In such cases, all of the dysfunctions should be diagnosed. Clinical judgment should be used to determine if the sexual difficulties are the result of inadequate sexual stimulation. In these cases, there may still be a need for care, but a diagnosis of a sexual dysfunction would not be made. These cases may include, but are not limited to, conditions in which lack of knowledge about effective stimulation prevents the experience of arousal or orgasm. The Altman Self-Rating Mania Scale is a suggested Level 2 measure if the person reports mild or worse severity on item 4, sleeping less than usual, but still have a lot of energy, and or item 5, starting lots more projects than usual or doing more risky things than usual on the Level 1 measure. The ASRM has 5 questions, each rated on a 5-point scale with an individual descriptor for each possible response. The range of scores is 5 to 25, and the time focus is the past week. The interpretation table on the second page notes a score of 6 or higher indicates a high probability of a manic or hypomanic condition, and that a score of 5 or lower is less likely to be associated with significant symptoms of mania. I think there's something wrong with these numbers. The only way you could get less than 5 would be to omit 1 or more items. I have set up an extra credit forum where you can get extra points for using the DSM-5 definition of manic episode and hypomanic episode to suggest more realistic norms for this measure. For bipolar 1 disorder, there is a different diagnostic code if the current or most recent episode was manic or depressed, and a different code based on severity. DSM-5 is consistent in their use of severity specifiers, but ICD-10 has different severity specifiers when the current or most recent episode is manic or depressed. The DSM-5 diagnostic number code does not differentiate between a male's erectile disorder and a woman's sexual interest arousal disorder, but the coding in ICD-10 has different numbers for these 2 distinct disorders.